Good afternoon. Welcome to the weekly briefing in day 488 at the EMA office, where I'm joined with Mila Blanford, the director of the St. Clair County Health Department, and Chairman Mark Kern, where we bring you the latest in the COVID numbers. Mila, thanks for joining us this week.
Thank you, Herb. Good afternoon, everyone. For July the 8th through the 14th, we have a total of 349 new tests, out of a total of 4,336 for the testing period. The age range of positive individuals was under 10 to in their 80s. The weekly county positivity rate is at 8, with a match at a 7-day rolling average of 8. Regional positivity as of July the 11th was at 7.8%. Unfortunately, we do have one new death to report, a female in her 80s with unknown health conditions. Countywide, we had conducted a total of 384,120 tests, which consist of 32,171 positives and 351,949 negatives. Total number of deaths to date is 485. Condolences go out to those families. To date, the number of individuals who have completed their 10-day isolation period is at 31,243. Statewide, we've tested a total of 26,218,311 tests. Positive of that number was 1,398,409, which is an increase of 4,174 since we reported last week. Total deaths to date is at 23,343, and that's an increase of 65. For St. Clair County hospitalization numbers, the number of COVID-related hospitalized patients in St. Clair County is at 30. Regionally, we're at 53. Folks, I'm going to repeat that. We have 30 individuals hospitalized with COVID-like illness in St. Clair County, and regionally, we're at 53. That's a pretty big increase that we're seeing. Patients on ventilators is 0, and regionally, we're at 0. For congregate status, for those in outbreak, we have Cambridge of O'Fallon with 1 new case and Bree of Belleville at 1. We continue to offer testing at St. Clair Square Monday, Wednesday, and Friday and Saturday from 8 to 4. We also offer testing at Walgreens, CVS, MedExpress, and a variety of locations throughout St. Clair County. For vaccine, the best tool that we have against COVID-19, we offer that at 330 West Main, Monday through Friday from 10 to 6, and Saturday from 8 to 4. You can drive up if you want to receive Pfizer, or you can call the call center at 825-4447, Monday through Friday from 8:30 to 3:30. Again, we will take drive up for Pfizer during those times without an appointment. There are a variety of other locations throughout our community that offer vaccine. You can go to our Facebook page or our website, as well as St. Clair County EMA social media to get that information and look what you need to do to register on those sites. Chairman?
Okay, and Mercy Rehab and Care Center saw 4 additional cases, is that correct? That's on my sheet.
Yes, I am
Yes.
sorry. Mercy
Oh.
Rehab and Care Center.
Don't be sorry, I just wanted to make sure that everybody knew, because we only are here once a week, and so we got to make sure we take advantage of this time. So let's move into the zip code report for today. Now, there are only 3 zip codes this week with no change. So when you listen to these numbers, you're going to see just how serious a situation we are in. In 62201, we're up 7 this week to 642. 62203 up 13 to 720. 62204 up 9 to 465. 62205 up 18 to 742. 62206 up 34 to 1552. 62207 up 22 to 708. 62208 up 35 to 1839. 62220 up 26 to 2301. 62221 up 29 to 3055. 62223 up 21 to 1968. 62225 up 4 to 167. 62226 up 31 to 3,532. 62232 up 1 to 967. 62239 up 12 to 524. 62243 up 2 to 814. 62254 up 1 to 841. 62257 up 3 to 366. 62258 up 9 to 1,138. 62260 up 3 to 860. 62264 up 2 to 380. 62269 up 41 today to 3,589. 62282 up 1 to 73. 62285 up 1 to 606. And 62289 up 1 to 56. So remember, that's for the past week. And we've really risen a lot since last week. Remember, 1 month ago, our 7-day rolling average was 2.1%. Today, we come in at 8%. So we're seeing these numbers really rising at a rapid level, and we've got to see what we can do to stop that. Regional positivity is fairly similar to the 7-day rolling average in St. Clair County. It's up also to 7.8%. So I think perhaps one of the first guests we had from Team St. Clair that came on 488 days ago was Dr. Omer Bodeman, infectious disease specialist, who is here from Memorial Hospital, BJC. And Doctor, we're really honored to have you back here, and I know you've been a strong spokesman throughout this entire process, encouraging people to do all of the things necessary to try to lower the rate of COVID and get this solved in our community. Where are we at right now, Doctor?
Well, we're seeing more cases of hospitalization and infection in our community. A month and a half ago, we had no patients in the hospital. Now, on an average, we have between 10 to 15 patients a day in the hospital. So there is an uptick on the infection rate. There's an uptick on the test rate in the communities. And it's not just our community. If you look at the entire country, 45 states are reporting that there is an uptick on COVID-19 infection. And predominantly what we're seeing now is the Delta variant, which is much, much more contagious. And also, we think it makes people much sicker. From my experience, what I'm seeing in the hospital is we're seeing much sicker patients. And we're also seeing the demographic is changing, who's getting this infection or who's being hospitalized. Did a little data from our own hospitals, which I collected in the past first quarter of 2021 and second quarter. And if you look at the first quarter, the number of cases or percentage of cases in the younger population under the age of 25, we're only seeing about 9% of the positivity rate. And now we're seeing close to 30% on the second quarter. And the most important one where we're seeing a higher number is between the age of 26 and 50. We're seeing the first quarters we're seeing about 28%, and now it's 45%. So between 0 to 50 years old, we are seeing close to 70% of the cases that is positive in the second quarter.
So what is the common denominator amongst all the people that are in the hospital that are getting COVID? What do they all have, or what do most of them have in common?
98% of the patients I'm taking care of in the hospital are eligible for the vaccine, but have not taken the vaccine. Make no mistake, all the vaccines that are out there, the Pfizer, Moderna, or the J&J vaccine, all work extremely well for this Delta variant. So what we're seeing is people not being vaccinated. It's not people who are not eligible, or it's not people who got the vaccine. We have seen cases of breakthrough infections, and I have, since April to now, I have seen about 16 or 15 cases that have been vaccinated 2 weeks out and have never been tested 45 days, which is a breakthrough definition. And those patients actually did well, and even when they're vaccinated, post-vaccination, when they had the infection, I would assume that the virus they were infected with the Delta variant. So even if you get the virus after the vaccination, you have a better outcome in the hospital. I have only seen 1 or 2 deaths, people who've been vaccinated in the hospital. And one of the cases I personally took care of probably died of an arrhythmia, which is an abnormal heartbeat rather than the virus itself. So the vaccines are effective. They work very well. And so 98% of the patients that have been seen for the past 4 to 6 months are unvaccinated who are eligible to be vaccinated. So
this virus really is, we can take control of it.
Yeah.
We have the weapons.
yeah, what I tell my nurses and physicians in the hospital and my patient in clinic is the destiny of this pandemic or the pandemic strain that we're seeing is at the hand of humanity, not the virus. If we get everybody vaccinated and we do the right thing, I think we can stop this pandemic. But the longer we leave this virus to circulate, we saw in the beginning we had the Alpha strain, and then we had the UK strain, the B117, and now we had this Delta strain. And there will be other strains. As long as the virus is allowed to run rampant and infect other people, we will get more different strains. This is the nature of this virus. It changes, and it has the capacity to change. I mean, human beings, their genetics change 8% or 3% every 8,000 years. This virus is changing every week. So the fuel for its change and changing from one strain to another is, in fact, humans being infected, and that we are the fuel for this virus.
So let's talk a minute about when you have someone come in and you're taking care of that has not been vaccinated, they've contracted COVID. Did they ever tell you why they didn't get vaccinated? Does anyone have I know some people, there's a medical reason, perhaps a religious reason, but that's a very small percentage. Are people telling you, well, I just didn't know, I didn't have access? Are there any excuses that were things that we could fix?
There are two groups that I see. The first group is misinformation. They're told by somebody this vaccine has not been studied well, it's been rushed, it's been this, it's been that, and then you go the far out there who think that this is a vaccine that is made for many different reasons, which I don't like to mention but mainly it's misinformation. The second group was they didn't think the virus was that dangerous because they don't see around them in their community that, or they don't know people who've died from this virus or ended up in the hospital. So there is not that urgency to get the vaccine. I wanted to get the vaccine, but I didn't have time. I had to do this, I had to do that. But these are the two groups. One is the lack of urgency, and the second one, which is very concerning, is the misinformation. There is a lot of people misinformed. Either they go on the internet and look for the information, or they talk to other people. And words spread by talking with each other, with other who tell them, yeah, we heard this vaccine is this and that. So really, the thing I can tell the public is if you really want information about the vaccine, talk to your healthcare provider, your health department, the CDC webpage. All those will give you the best information and the safest information. The second, if you are hesitant about getting the vaccine because you don't think it's that urgent, it is. It's very urgent because, I mean, we've been 16 months with this and close to 600,000 Americans have died. I have not seen any, in my 25 years career as an infectious disease specialist, I have not seen any infection that have killed 600,000 people in 1 year or in 16 months.
And 485 of those in St. Clair County, right here in our home.
Yeah, so I think it's our duty, and if we care about our community, if we care about our neighbor, our family, our friends, even if I am a young, healthy person, I still would get vaccinated because, again, I'll repeat this, we hold the key to ending this pandemic. We get vaccinated, everybody gets vaccinated, we get over 80% vaccination rate, even the more the better, then most likely we'll end this pandemic.
So if people have concerns, they need to go to the to a source, a medical source, to find out whether those concerns are warranted, whether it be side effects or I know I've heard some females are concerned if they're trying to have a family, they're concerned about vaccine. Have you seen any of the side effects that people seem to be concerned about other than a sore arm or those kind of things?
We have given, I think, in the United States close to 335 million doses. And it's been almost a year since the vaccine has been given. I have seen very minimal side effects. Most cases, the soreness and the pain and the little fever that lasts 2 days and it's gone. This very rare side effects of blood clots or inflammation around the heart. Exceptionally rare. I mean, the best example I can give is, if you look at the side effect of some high blood pressure medication, which is the most commonly prescribed medication, like lisinopril, we use it and we've been using it for many years. There are side effects with those high blood pressure medications. Some of them can be very fatal, but we don't stop using them because they work exceptionally well. So the benefit of the medication outweighs the risk, and the COVID vaccine even is much lower. So in my year of doing all this, I have never seen anybody being hospitalized for the side effect of the vaccine. I've had some people who've had localized reaction. I don't even remember seeing anybody who's had blood clots or any complications of that, or anaphylactic reaction or severe reaction. So it's exceptionally safe, and I've taken the vaccine myself, and I think everybody has seen that. My wife got the vaccine, and just a month ago, my 13-year-old, as soon as I found out that the Pfizer vaccine was approved for children, I did give it to my 13-year-old, and hopefully down the road we will get more approval for the younger ages, and I have 4 kids, they're all going to be vaccinated. This vaccine is just as safe as the flu vaccine that we take every year. And we have a fight to fight, and the only way that we can end this pandemic is it's in our hand. It's not on the virus.
So, and just to wrap up, I think many people might not realize that as now we have 30 patients in our St. Clair County hospitals, 53 in the region. Now your hours are getting longer, the nurses' hours are getting longer, all the doctors and the medical staff and all of the stresses that were over, or at least appeared to be over a month ago, they're all back. How is that emotionally and mentally affecting the employees at the hospital?
Well, you get fatigued. It's 16 months we've been doing that. The first case of the COVID-19 patient that entered in our hospital was, I think, March 1st. And it's almost a year and 4 months now. Since then, it's been an up and down fight, And I don't think the healthcare providers are going to complain about this, and we're there to do our job, and we will do that, what may come. And the hospitals, the nurses, they have been one of the best people that I've worked with around, and the camaraderie and the care that they have provided. But you're right. Nurses, physicians, respiratory therapists, the techs, we get fatigued and we get tired. But if this is what it is, we will take care of anybody who comes to our hospital, and we will do that as long as it is. But I think we are willing to play our role, and we will do that. I think the public also has to play their role. And it's a year out since we've been giving the vaccine. And the side effects and the problem with the vaccines are very minimal. And the idea that people think that you get a vaccine now, a year and a half later something will happen to you, it's not common. Over 100 years of vaccine manufacturing and vaccination, the most common side effects and problem appear in the first 45 days. And with this vaccine, prior to approval, it was taken out to 90 days. And I have discussed this in the past, all the vetting and the way the vaccine was manufactured and was done was exactly the same as any other vaccination. It's just that technology is so good nowadays, we are able to do things much faster. Just like manufacturing cars. We used to, 1920s, when Ford was building cars, it took them a month to build a car. Now Ford builds a car every 6 to 8 minutes. It doesn't mean that the cars are defective. It's just that the technology is better. The same thing with vaccine manufacturing and medicine. It's just like any other technology. And we're very lucky that the newer technology, mRNA technology, are out there, and they were there and they came on the right time. If this would have happened 30, 40 years ago, we would have waited about 6 months to a year or even 2 years for a vaccine. So we should embrace the technology that's bringing us a better vaccine, a faster way. This is not a defect. This is actually a positive thing to look at. And it's a year out. And we have seen very minimal effect of the vaccine. So I urge everybody out there, go get vaccinated, because we don't want another spike, and we don't want another strain probably where the current vaccine may not work, and then we're going to go back to remanufacturing new vaccines and getting the whole population vaccinated again.
Well, Dr. Bodeman, I sure thank you. You have been a true hero to us during this. You have been a face on television. You have been out there as much as anyone, encouraging people to do the right things, and we really thank you for it. You really,
Thank you for having me here.
made a big difference. Thank you. Herb?
Well, Chairman, if that doesn't reach some of the population out there, and I know Team St. Clair, there's quite a few of them on here, some new people on watching today, but Doctor, I think you've really broke it down to them, because this isn't just something that one of us, a group of us is in. We are all in this together. You know, I'm glad the chairman brought up about the healthcare providers, the physicians, the nurses, because the people who choose not to be a part of the solution are putting yous at risk every time they come in, because then they don't have to do that if they go get vaccinated. And so it's a team, and we've said that from day one, 488 days, Team St. Clair. And if these numbers aren't telling you that we still have this amongst us, as the chairman said, out of 27 zip codes in St. Clair County, all but 3 of them has cases in them. I remember here just a few weeks, a month ago, you know, it was just the opposite. So it's definitely out there. We've been telling you that. We said, okay, we're going to start doing a weekly update to keep you all informed. The last thing we want to do is to go back to a daily. But so what I'm asking you today, yeah, I think it's time we really, really have to take a look at this. So for all of you that are on here today, Team St. Clair members, spread the word. You heard Dr. Bodeman say, we control our destiny here. You can either be a part of the problem or you can be a part of the solution. For those of you who've got the vaccination, thank you. Thank you from the bottom of our heart, and from each and every one of us. We've all been vaccinated. And for those of you out there who have been, I know you've probably talked to your family, your neighbors. Continue to talk, because that's what we're going to continue to do. We are going to talk until this thing is under control. If you remember back at the beginning, there were some people that would follow this feed that thought we were nuts, we were crazy, but we've been here for 488 days, and that's because it's a reason to be here. There was one comment on here, when do we stop worrying about people who refuse to be vaccinated? It'd be nice if we could do that. But those same people are the ones that have the potential to infect us at the grocery stores, at the gas stations, at the convenient markets. So until we can find a way to get them people convinced, we're going to be here spreading this word. So we need your help. We need everybody's help. So please spread the word. As Dr. Bodeman said, he's encouraging everybody to get vaccinated. If you're not sure, talk to your physician. That's what they're there for. I'm sure that if you go and talk to them, they're going to tell you, just as Dr. Bodeman said today, the side effects is definitely less than what happens if you get COVID and end up in the hospital on a ventilator. So again, let's be a part of the solution. We'll be back next week, next Wednesday, unless something happens in between. Follow our page. We try to keep everybody updated. If there's anything that changes, we'll be sure to post it out there. Thank you for joining us.